Well, hello, and I am really very pleased to be with you and talk about some of the things that are impacting our agricultural community. Um, on behalf of the AgriSafe and our AgriSafe staff, I am just, it's been a great opportunity working with an organization that gets me back to my farming roots. I am here in Eastern Iowa, and I have been working out of my home office with AgriSafe since we're a virtual community, if you will. And it's been interesting, as you know, with COVID and all these other challenges that our agricultural workers have been battling across the country. But I am really grateful to the Southeastern Coastal Center for inviting us to participate. A lot of the programs that you have been attending and listening to have been research oriented, and that is fantastic. I am not a researcher. I need to let you know that. I am kind of part of the R2P, research into practice model, and really stand on the shoulders of all the great research that's done. And nothing makes us happier than to take a great research project and take a look at it and say, how can we make this work in the agricultural community? So that's what I've been doing for several years, and I love every bit of it. For right now, we're going to start talking about some of the respiratory challenges in agriculture, things like getting respirators, getting them fit properly, and what has COVID done to that, and what have we learned from it with COVID-19 as the SARS whole bunch of viruses go. There's a lot we don't know. As someone has said, we don't know what we don't know yet, but we are learning, and we are hoping to be a little bit smarter as we keep going along. AgriSafe is one of the things is we affiliate with the NIOSH Center for Total Worker Health, and our affiliation runs as the Total Farmer Health Program. We took the Total Worker Health model and spent some time looking at it and how we could use that in the agricultural arena. So we have done that now since 2014 or 15, and call it Total Farmer Health, because most of agriculture in the United States still really is based on the model of a family operation, some small, some pretty big, but usually center around a family at its nucleus. So, and there's so many things that impact our work in agriculture, because it's one of those businesses, one of those industries that, you know, you don't work an 8, 9, 10-hour day, and you have all kinds of things impacting from weather to family issues to anything that can happen usually happens in agriculture. And we are very lucky with our affiliation with NIOSH and NIOSH centers. And as this little map here, as most of you know, show you where the agricultural centers, the NIOSH agricultural centers, happen to be across the country, and we partner on various levels with all of them, and have done some really unique programs with some of them. And we are happy to partner with the Southeastern Coastal Center and some of the staff there that we've worked pretty closely with. So this is a pleasure for us. When we're talking about respiratory, just like anything else, we go back to the CDC NIOSH model that has this upside down triangle that talks about safety considerations and what can we do. And we obviously always say the best thing to do is to engineer those dangers out of the environment if at all possible. And agriculture works at that. They truly do, but it's one of those businesses where sometimes it's just not possible. We do get some substitute programs in there, some substitute ways of doing things, of practicing. We do have the opportunity sometimes to redesign that work environment. We are always pushing the importance of educating not just the workers themselves, but our supervisors, our people that are business owners, that are the producers that manage the whole operation. and knowing that things change so fast. So we always have to be on the alert for what's new, what's changed, what's different, what's better. And when it comes to personal protective equipment, particularly respiratory equipment, we need to keep encouraging our workers to use it when it's needed and to know what to use. And while we're doing that is encouraging personal change. In agriculture, I don't know about a lot of you, but around here, it's been sometimes a slow moving vehicle getting people wanting and interested in wearing respiratory protection, hearing protection, any of those things. But progress has been made, and it's getting better all along. So we are feeling really good about that. When we talk to folks about respiratory protection as other things, we say the first thing you need to do is know what you're exposed to. Know those exposures because there are so many of them. And in agriculture, it is everything from what's growing in the ground, whether it be produce, whether it be feed for animals, whether it be bedding, grain. A lot of our grain is in bins, and they create tremendous dusty situations. We have animals that are in confined spaces as they're being fed and getting ready for market. And we know that there's all kinds of stuff floating around in the air in those situations. We also want people to be aware of the fact that there are a lot of gases that have a strong impact on your health. And the University of Iowa, the Great Plains Center, one of our agricultural centers, did a great chart a few years ago on some of the major gas exposures and the different levels and how they can impact your health. The other thing we are concerned about is a lot of our producers are young families. We know that women are working very hard in the agricultural arena. About a third of our farm workers and farm and ranch owners are women. So they're right there doing all the stuff. And a lot of them are in those childbearing years where they have small children or having babies or planning on it in the future. And so they have all these exposures as well. We know that everybody recognizes this by now, this picture of our wonderful COVID-19 virus. And it was a real problem in the early spring of 2020. And there's still so many puzzle pieces that are missing as to how to deal with this and how to respond and what to use to protect ourselves. And fortunately, now we have gotten to the point where we have vaccine available. So that has been one of the big hurdles. But we still have that protective equipment piece that we are learning about and trying to provide more information in our communities. The basics of respirator use, well, it comes right down to the very, very core of it is when you're using respiratory protection, the fit is the key. Is if it doesn't fit, it doesn't make any difference how expensive, how elaborate it is. If it doesn't fit, it's not going to work. All respirators, and we refer to the N95s as respirators. The proper term would be respirators or filtering face pieces, but we sometimes use the term mask because that's what a lot of the people we work with are used to using. And sometimes that resonates a little quicker. But anything N95 and above has got to fit tight to the face and allow no air leaks at all. And if it's worn correctly, it will filter out about 95% or more of those particulates that contain all the nasty contaminants that we breathe in. But they have to be done, they have to be put on correctly. A fit check has to be performed every time it's worn, and it has to be removed or doffed properly. I love this slide that the EPA developed some time ago, and it is a great teaching tool because it shows what we're talking about when we talk about the dust that we want to filter out. We know that the particulates in the air that we're breathing in that really are damaging are the ones that we can't cough out, sneeze out, that sort of thing, that get down really super deep in our lungs and can cause chronic illnesses, can cause all kinds of respiratory issues. And so we want to really impress upon people the size of these particulates. So we use this chart from the EPA, and that big long gray represents a human hair, which would be anywhere from 50 to 70 microns in diameter across one single little hair. And the dust and the pollen and the mold is oftentimes less than 10 microns. So you can see how it can filter in and be such a danger and really impact our respiratory health. And then we get to our little SARS-CoV-2 virus, which is the COVID-19. And SARS-CoV-2 is 120 nanometers. And if you try to wrap your head around that, there are 1,000 nanometers in 1 micron. And if a human hair is 50 to 70 microns, look how tiny that stuff is that we are dealing with when we're talking about COVID. The other thing that's so important to remember when we're talking about respiratory protection is the fact that that fit check or seal check, we use the terms interchangeably, is really important. And that's an employee or the person that's wearing the respirator. That's their responsibility once they learn how to do it every time a respirator is used. And these pictures will show folks how to check that. Once you get it on and get it tightened up, your half-face respirators, how to do a positive and negative fit check, a pressure check. And that's, putting your hand over the filters and blowing air out and then sucking air in. And this is a very important procedure, and one of the first things we have to make sure our employees know how to do. And pictures work well because so many of our workers are not English certainly is not their first language at all, and sometimes they speak very little English if you're using English when you're teaching. So pictures are really important. OSHA just last year came out with this little teaching guide, this little chart that talks about the 7 steps to correctly wear a respirator at work. And this one shows the 2-strap filtering face piece, the mask. And this particular document is available in Spanish, and they also have a short video that walks through, and it's also available in Spanish. So this is a great teaching tool for our farm workers. 3M has another one, and you see that on the right, and that also talks about how to put on a filtering face piece. When we're fit testing a face piece, a filtering face piece, or the mask as they refer to, there are some times that it is required and sometimes that it's not. A fit testing is required if your employer requires the use of respirators for whatever you're exposed to. As an employee, if they're exposed above those OSHA permissible exposure levels, those PELs, if those aerosols or those particulates are over a certain level, then your employer will say you probably have to wear these respirators, and then you have to be fit tested. If workers wear respirators on a voluntary basis, in other words, they're wearing just to be comfortable, or there's no mandate to wear them for any reason, but your employer says, yes, you can wear them if it makes you feel more comfortable, then you don't have to fit test these filtering face piece masks with the 2 straps. If they're wearing half-face respirator with the cartridges, that's a different story. Those have to be fit tested. People often ask us, well, what is a fit test and what do you use? And if you have a bigger operation, a big business, where you're doing a lot of fit testing, like our hospitals and some of our bigger ag businesses, our automobile industry, chemical manufacturers and such, they may do quantitative with the instrument like a port account, where everything is kind of done automatically. But it's expensive equipment to invest in, and you have to need to use it a lot. Multiple times during the year in order to make it cost efficient. Most of us in the agricultural community or small businesses use a qualitative or a pass-fail system. And that's where we use the different solutions. And you can see the picture there about the hood and spraying the solutions in. And all of this information is available on OSHA. They have a ton of great respirator use and respirator program information for you. But the one in the bottom is the one that we typically use in most of our smaller agricultural operations. There are a few guidelines I just wanted to throw up here, just a few very important points. And the fit test guidelines is a large document, but some of the big important things to remember is that the person being tested, needs to conduct that seal check, that fit check, and that has to, as we said, has to be drilled in, that has to be done every time. And a valid test cannot be conducted if there's hair growth between the skin and where the sealing surface on the face piece is, like a stubble or a larger mustache. Any type of apparel that interferes with the fit has to be altered or removed, and that can be earrings. Sometimes it depends upon how their glass frames are made. Those sorts of things have to be looked at when you're looking at getting a good test and a good check. If the person that's being tested has any difficulty at all breathing during the test, says they have any issues with health, like high blood pressure, shortness of breath, any of that stuff, they have to be referred to their healthcare professional in order to determine whether they can wear a respirator at all. And that's a call of the licensed healthcare professional. The fit test has to be performed while the person being tested is wearing any safety equipment that they might be wearing during an actual respirator use. In other words, they have to wear that equipment. They have to have everything just the same as if they were on their particular work site. And this is all covered in the OSHA laws and regulations extensively, and they're pretty easy to follow. One of the things that really surprised me when I started looking into some of these is this chart from CDC NIOSH. I had no idea there were this many different kinds of beards and mustaches, and that they had names even. But it really is an interesting little piece, and it's very helpful because there are some facial hair that you can get a respirator around, but there are not that many of them. Obviously, clean shaven all the way around is the ideal. And anywhere that mask or that respirator touches has to be clean shaven so you can get it really tight. But they have this great little chart that you can use, and if you have anything to do with fit testing and all of that, it's a great way to explain that this isn't something that you made up, that this is the law and the regulations here. If an employee uses any respirator with the tight fitting face piece like they need to have, they've got to be fit tested with the very same make, model, style, and size of respirator. And this is where we have some issues sometimes, because an employer may say that there's only going to be one kind of respirator that we can provide, and it's going to have to work. Well, sometimes it just doesn't, because no respirator fits everyone and not every face. And if it doesn't fit, it doesn't work. And it can be all kinds of different things can happen. It depends upon the size of their face. Maybe they've had dental work. Maybe there's weight gain, weight loss. A lot of things can impact how these fit. And so we need to be able to provide more than one model. A lot of folks will ask us, what's the best type of solution to use when I'm doing this fit test with the hood? And the most common one that most people are used to is the saccharin solution, the real sugary, sweet solution. And if your respirator isn't fitting tight, you pick up on it right away. There is a solution, a Bittrex solution, that some people like to use. It has a real bitter taste to it. And it is bitter for a reason. Number one, because some people for whatever reason, are leery about using these sugar solutions. They may have a health issue where they say, I can't do that. So they will use the bitter. And Bittrex is, it's bitter, it's a taste diversion, and it's the same stuff that's put in some household liquids to protect kids. And it's endorsed by the American Medical Association, Safety Council, and the Association of Poison Control Centers. So even though it has a horribly bitter taste to it, it's safe and has been validated. Some programs, some employers will use irritant smoke. It's not as common, and when you do that, you have to have a HEPA filter that you're testing with. But there's some of our automobile workers and oil industry workers that use this. It has to be used in a ventilated area. So this is why a lot of our fire departments will use irritant smoke as their testing solution. It isn't as subjective as saccharin or the bitters. But it works, and a lot of people like to use this one, but they do have to make sure that they have P100 or HEPA filters in place when they are testing. The banana oil is one, again, that's not used very often, but there are some employers do like to use it, and you have to use organic vapor cartridges, so you only use it when you're testing your half face or full face respirators. So again, it's not as common, but it is used by some employers. One of the questions folks will ask is, who can do a fit test? How much training, education do I have to have? Or can anybody do it? And the answer is yes, just about anybody can. The person that's selected to perform the test has to follow a very strict procedure and document the results, and the whole test has to be considered compliant. It would be wise to make sure that you designate someone who can become familiar with the test and adhere to all of the standards for compliance, because as an employer, you don't want to wind up getting dinged, getting fined for not having a compliant program. We tell people, if you have somebody in your employ that you want to be your fit tester, you can go through, there's a lot of written information that will tell you just how to do it step by step, but the easiest way to do it is to go through the materials and then work with somebody that has respirator fit testing experience and can tell you some of the little tips and tricks to the trade, if you will. You can purchase a fit test kit. The instructions are all there. There are online courses to do it if you want. The 3M has theirs. The different manufacturers have their programs that they use. One of the things that some people will talk about is, we know the medical evaluations have to be done, but isn't agriculture exempt from all of that? And tell me about that. Well, yes, in many times agriculture will be exempt from it, but agricultural businesses need to really look at how they are classified as a business. Because sometimes I had an incident with some of Christmas tree growers that thought they were exempt from everything because they were agriculture, but because of what they were doing and the size they were not. And another one is the grain elevators. Even if it's a small grain elevator, they are not exempt from a lot of the OSHA exemptions, so they have to look at these things. Even if you are exempt, even if you are a small farm operation or a medium-sized farm operation, it is still best management practice. And it's best management practice for the business managers and for the healthcare providers in the community to use those OSHA medical guidelines, to use the standards, to ask the questions related to the work environment, get good general history of respiratory cardiac conditions, checking blood pressure and pulse rates. All of those, and documenting all of this stuff will make sure that you don't wind up getting into a legal issue at some point in time. In addition to all of those basic fit test pieces, I always like to encourage people to observe somebody's ability when they have a mask on, whether it's a mask or a respirator with cartridges. Have them wear it and walk around corners, go up and down steps or even a ladder. Go from a high-level light area like sunshine into a low-level area like a darkened room or a shop or a work area, and spend adequate time learning how to clean all of that equipment. So those are always the important pieces that go along with that. Pesticide applicators have additional responsibilities, that's for sure, and many of our communities, and I know in Florida you have an awful lot of pesticide applicators. So pesticide applicators and handlers, are they required to wear respirators? They're required to wear respirators if the pesticide label calls for them to do so. And it is so, so important to make sure that we are talking about wearing respirators that follow the guidelines, and depending upon the chemical, it's all over the charts how much protection you need or don't need. And which pesticides require respirators? Again, read the labels on the pesticides. All the information is there. For those of you that are healthcare professionals or managers, the EPA has a recognition and management of pesticide poisoning manual that really goes through everything and helps you lay all that out. So that is an excellent, excellent resource. And the worker protection standard is out and available, and it has all of the requirements listed for pesticide handlers. So when we get around all of that, and we also are trying to do that, and oh, now we have COVID to deal with. Well, what happened when COVID hit? Well, as you know, all of a sudden, a lot of respiratory protection became unavailable because we needed all of it for our frontline healthcare workers. And I know here, my stock supply, I just packed everything up and gave it to our local community health center. And I wanted to do that, but I also kind of hated to do it in a way, because it meant I didn't have it available for our farmers, for our folks that are dealing with the mold and the mildew and the animal dust and all of that business that we are encouraging people to wear respirators to protect themselves. But what we did find out is that we had to do some really deep digging, and we know that the N95 respirator is kind of the go-to basic that covers so many needs in so many areas in the farming arena. So what did we do? Well, we found that there were other levels of protection that were a little more available. So we had to encourage our farming and ranching folks to say, well, if you're used to wearing an N95, that's all well and good, but you might need to step it up to a different level just because of availability. And we looked at the enforcement guidance for respiratory protection because of the N95 shortage, and that's still out there on OSHA. And some of these things are changing because this all started in 2019 when they were putting this guidance together. It has certainly changed in the healthcare arena because now respirators are much, much more available. But depending upon what they need, some folks are still having a little hard time getting the N95s, but more and more providers, more and more distributors have them readily available now. So it's not nearly the issue that it was even a few months ago, and it's continuing to get better. But as employers, they need to be looking at the guidelines that are coming out all the time and how they are changing. We know, as I said, for healthcare, they have changed. The leniency is not there that was there before, and it is probably going to be changing in a lot of the other business areas before too long. Pesticide respiratory protection during a pandemic was really a big issue. This was the one that was really the big hurdle to try to get over, because we know that EPA could not change what they said about label required PPE. As again, there was no substitute for reading that label. Homemade masks are not sufficient for pesticide protection. And there was no exemption or relaxation on the requirements made by EPA when it came to that piece of it. What they did get, OSHA did, is get a little more open as far as the people coming in and looking at your programs and how are you testing your workers and all of that. But it was still there. If you're doing pesticides, you have to have the proper protection on, or look for a different type of pesticide. So that was a real barrier for a while. But as I said, gratefully, thankfully, things are changing. As I said, there have been some changes. The OSHA Interim Enforcement Response Plan is still in force, but as far as the inspections go, the National Emphasis Program is still in effect, and the emergency temporary standard, if when it comes out, they will be modifying that. So these are things to watch for all the time. And if you go go to OSHA and look at their just say, you know, updates on enforcement response plan, you will see them, because they said they have changed for the healthcare industry for sure. The EPA temporary guidance on respiratory protection was just updated in March of this year. And they're saying pretty much the same thing as, you know, if you're pesticides, you've got to wear what the label says. But the on-site reviews and inspections and that are there. You're going to be pretty hard pressed now, because the PPE is available to use that as an excuse for not doing your programs the way you normally would do them. We do like to remind people that OSHA has an on-site consultation service that has absolutely nothing to do with the inspections side of OSHA. And they are willing, and we are really encouraging everybody to call your state OSHA if you have questions about this, and just ask them, because they will come in and talk to you about it, tell you what you need to do. They don't have anything to do with fines or anything like that. But people are still very worried that we're not necessarily telling the truth when we tell them that. But every state has a consultation service. They change state by state. I backed up here. Agricultural workers need PPE information, the workers themselves, because the workers are essential workers, and they have struggled to obtain what they needed as PPE, and it's been very stressful for them, and they're still very worried about some of these things. And we know that it's just a stressful time all the way around. The supply has improved. The lessons for us, the lessons learned were a couple of things. Number one, supplier communication. This has got to improve. If we're going to ever have to deal with a situation like this again, and there's nothing says we won't, we've got to look at making sure that our communications back and forth, as far as producers, as far as healthcare providers, that we have better communication and figuring out who are the go-to people. And we've told a lot of our groups, and have been fairly successful, the individual farmers, the individual growers would work through their membership organizations, whether that was like the Corn Growers or Farm Bureau or whomever, to work as a larger group when they're looking at purchasing and getting access to equipment. An organized effort is just really essential, and we found that it took a while to learn that, but it did really make a difference. Will it happen again? Your guess is as good as mine. I expect that, yes, it may. What has AgriSafe, what have we done as our organization? We began our work in COVID with a think tank, and we included all kinds of different people to come in as invited speakers. They address primarily what ag producers need to know. What do they need to know about COVID? In addition to having folks from healthcare and scientists and researchers and educators come in, we also invited the directors from ag centers, veterinarians, membership organization board members, control managers, risk control managers, outreach providers. And everybody had a say, and everybody had input, and we learned so much, and it really helped us when we went into program development. We really felt by doing this think tank forum that we kept the industry informed, and we obtained so much information about individual feelings, group feelings in the agricultural community. And it gave a place for agricultural workers to keep up with how they were being impacted, and to know that they weren't alone in all of this crazy mess going on. And it provided a really broad range of really accurate information. We could get the truth. We could get the real deal information. And it fostered that sense of unity that we're all in this together. And I think every one of us really needed that this last year and a half, and we still do. And we're going to need it going forward as we still develop programs and try to protect against any further issues like COVID. We had over 1,000 total number of attendees on our think tank sessions, and these are some of the topics that we talked about and have information on. We still have the recordings on our website, and we talked about everything from epidemiology to the CDC guidelines to mental health and stress management and insurance coverage and how are kids impacted and all of those things, and the impact on the animals because it is a zoonotic disease. We really kept going back to the World Health Organization and CDC and the One Health model, One Health, that it involved everybody, and it really was the best way to go for us, to include everything and everybody working together, because we know that it impacted so many people on so many levels on so many different ways. And just reminding everybody that the World Health CDC, we understand that well over half, and some people will say 3/4 of the infections that people get are zoonotic, so that they spread back and forth, and that we're going to continue to deal with these things as time marches on. These were some of the things we did with our planned COVID response initiatives. After the think tank, we did a 3-part series, and we have it ongoing right now on, we're developing and putting out a 3-part series on contact tracing, vaccine availability, and a worksite assessment. And these will be going out the door via webinar this summer and into early fall. We've been asked to do something in field sanitation. We have not done that one yet. We did a great vaccine webinar. Dr. Lisa Marici from Tulane University did a really great one on dispelling the misinformation about COVID vaccine and what producers need to know. And we're going to be repeating that in another month or so on one of our webinars. So we do have that information available for folks. We collaborate, and we have resources out there that we work with all the time. An example are some of the ag centers like your Southeast Coastal Center, SCCAHS out of Nebraska, several others that we've worked real closely with. The PerkMed folks on the West Coast have been a big help with the information that they put out. Lisa Marici vaccine, it's on YouTube, that webinar, if you ever want to access that. And it has also been a subtitle in Spanish. So it's there for our Spanish speaking population. If you have problems accessing it, do get a hold of us and we will walk you through that. One of the other things that we've done is we just signed an agreement with the CDC as an IPA provider, and that's Intergovernmental Personnel Act. I can never remember what IPA stands for. If like me, maybe some of you just think of it as a beer, but anyway, it is a CDC program. And we're going to be doing some things on partnership promotions with social media and membership groups. We're working with the Rural Nurses Organization. All of our state rural health associations have been invited to work with us, and we've got some programs in the works at that level. We're developing infographics as I speak on vaccine safety, on hitting those vulnerable populations, the elderly, the young, women in childbearing ages, people with language barriers, all of those different things, and infographics about continuing with precautions. We're going to be doing some very short video productions, little clips, and we're going to have those done with our local farmers and ranchers across the country. We'll provide part of the script, but we want it in their words about the importance of vaccine and addressing the hesitancy issues. We'll be using health coaches. We'll be using our nurse scholars from our AgriSafe Nurse Scholar Program. Those are nurses across the country that have taken some classes on the basic stuff that goes on in agriculture as far as exposures go for folks. We'll use local teachers. Anybody interested in working with this, let us know. We want to really make these local and make them so that they really address where folks are. Where is our journey taking us now? Well, we're going to be continuing to work with commodity associations and getting the message out on vaccine hesitancy. We're inviting stakeholders across the board to share information in your region that you have on hesitancy. This is a give and take. We want to make sure that we have the best information available, and sometimes the best information is what you have in your backyard. We do have some potential USDA funding coming for beginning and farmers and ranchers, and that would contain emergency funding for COVID response that focuses on hesitancy. And we're also keeping with that the guidance on infectious disease control. And watchdog, we are really not sitting back and saying this is all over. We are preparing for variant potentials coming out and hoping to be better prepared as we go along. So any information anybody has, any suggestions, we are all ears. And I close with this. I use this a lot. I love this. It says you always walk through life as if you have something new to learn, and you will. This is my contact information. Get a hold of me if you want. Philip knows how to get a hold of me, and I have enjoyed being able to spend some time. And again, thank you so much to the Southeastern Coastal Center for pulling all of this together. It's been remarkable. Thank you.
Well, Charlotte, I want to also thank you for speaking and giving that great presentation. At this time, we still have about 15 minutes for questions, and so once again, use that chat box and just type them in, and we'll address those as they come in. So, as you're thinking right now, maybe about the presentation, yeah, feel free to type those in now. We did have a few questions in the chat box throughout the presentation, so I'll go ahead and read those, and then if there are new ones in, we'll address those as well. So there was a question earlier on about the particulate matter size of pesticides and residues. I think that was referencing the slide with the hair, piece of human hair, and that one. So I guess, how does pesticides and those residues fit into that, graphic, I guess?
Well, they do fit because they are, a lot of them are almost in vapor form. And so if you read the information on the labels, on the boxes, on the cans, on the containers, it will tell you exactly what you can use. Those particulates are very, very small, and as you can tell, they're almost like the COVID, some of them, because they're even smaller than that. That 10 microns is pretty tiny, but those vapors and some of those things that are in our pesticides, it's why these the masks, that the two-strap filtering face piece, the mask, the disposable ones, for anything that's wet, they are not really a good protector because they can absorb all of that. And so that's where those are some of the instances where those half-face respirators or full-face respirators with the cartridges are what you absolutely need to use because the paper will not protect against it. And I don't know if that answers the question or not.
Yeah, no, I think that answers it. And Jeannie, if you want to follow up more, feel free to put that in. Let's see. There was another question that just came in and one previously. Let me read that one. So I'll read the one that just came in, and then I'll go back one. So, do you have any sense of the level of compliance during the height of the pandemic with respirator use considering the challenges with getting N95 masks?
Compliance was not good. Let's just put it that way. And depending upon where you worked, if you're talking about working in agriculture, it would, because there was so much misinformation, you know, the whole thing about people thought, well, I'll just wear a handkerchief over my face and that will protect me. Well, we know the science behind it says, no, that doesn't work. So we did struggle with compliance because in agriculture, there's work to be done, and you're not going to tell a rancher or a farmer or a fruit or vegetable grower, well, you're just going to have to wait. That's just not how life goes. So we worried about that. We worried about it just from the health status standpoint. As we moved on through it, and as protection became more available for our healthcare workers, we've been able to get more of our agricultural folks back into the type of protection they needed to use. But yes, I mean, it's to say that compliance was not an issue. I couldn't say that, because I truly don't, I believe that it was a real struggle for a lot of people.
Okay, and then there was a question during the presentation. It says, I thought under new worker protection standards, a medical evaluation is required for those workers using respirators. So I think that was in reference to the fit testing and that part of the presentation.
The only ones that you don't fit test are the ones that are voluntary. In other words, if they're wearing that two-strap mask, and it's strictly voluntary, that there is no, that your employer is not saying you have to, or that your exposures are not requiring that you do, that you're just wearing it for your own personal comfort level. That does not have to be fit tested. But if it is mandated that you wear an N95 or a higher level respirator for whatever reason at work, then it is fit tested. If you wear a cartridge respirator, then it is fit tested. Does that answer your question?
Yeah, no, I think that does. And then if certainly feel free to follow up. There is another question that came in. It says, can you expand on what you said about wet masks absorbing the small particulate matter?
Well, it's just if you have a pesticide that's a spray, for instance, if you have a liquid that you're spraying, your mask is going, the potential is there for your mask to get wet on the outside. And those filtering face pieces, those disposable masks they're not waterproof. They're meant for being good protection for dry things. So if you have something that's wet, you need to be wearing a half face mask, a cartridge respirator, because those are a different material and will protect against the wet pieces in it. I don't know if that answers your question, but if you just think about those respirators, that respiratory protection, and if you get it wet, it's just not going to work the way it ought to.
Great. Thank you so much for answering those. And of course, thank you for the questions, for typing those in. Once again, if you have any others, feel free to type those in at this time. We'll give everyone just a couple more minutes before we wrap up. Looks like we don't have any other questions coming in. So Charlotte, I just wanted to open up to you if there's any last things you wanted to follow up with, or if you wanted to mention again, where to find some of those materials, or if not, that's fine. We can close out, but just wanted to give you the opportunity to have any final thoughts for today.
No, I think if anybody has any questions, if I wasn't clear, please get a hold of me and we will go back through the resources that we use. And what I am really encouraging people to do is to really follow OSHA's, um, what they're doing with their enforcement responses, their temporary guidances, because these things are still changing. And more stuff will be coming out, and sometimes it comes out rather quickly, and it's really easy to sometimes miss them if you don't catch the email. So we're, as I said, we're all in this together. We are learning from all of you. I miss having these face-to-face things because I love to sit down and chit chat with folks about this. But do get a hold of us, and we would like to hear what you're doing. What are you doing in your communities as we march through all of this COVID business? And thank you so much for taking part. And again, thanks to the Southeastern Coastal Center. You're doing a remarkable job.